Hope you're all well. So I thought I'd crack out the whiteboard to give you a bit more context into answering this question about grappler's elbow in further detail. So I'm going to go off my own experiences working with athletes and pretty much what I've dealt with myself in the past. And it's not as easy as just throwing out a set few exercises. If you're someone who's dealing with pain around that elbow, the exercises may make it more cranky. But one thing that we do need to appreciate that no one can escape is that biomechanics do have a big influence on the distribution of force through distal tissue. So if it's someone who walked into my gym with grappler's elbow and they were dealing with obviously medial or lateral elbow pain, the first place I would start is at the shoulder. Now, I'd always start above stream for this particular injury because I do want to assess whether the athlete or the client has sufficient ability to internally and externally rotate the shoulder. That is the first place I'd start. Now, the second place I would look at is actually at the site of the joint, which is the elbow joint. I would then assess the function of the elbow joint through flexion, extension, pronation, and supination. Now, these are the 2 points that I would rule out first before I even start prescribing exercises. And then the second part that we would start to look at is load management. How much training load are they doing through the week? Because if we can start to look at biomechanics and training load and connect the two dots together, we can start to paint a better picture and framework of where to guide this rehab process with obviously improving grappler's elbow. Now that we've established that it may be a biomechanical issue or not, and we've also assessed the function of the elbow, we can then start to look at exercise prescription. Now, the first place that I would start to not piss off the site of injury is training your hands directly, which is the lowest hanging fruit. It's a distal structure to the elbow. You're not actually taking the elbow through flexion, extension, pronation, and supination. You're just getting your hands to grip isometrically, which is going to have a therapeutic effect upstream to distal structures at the elbow. So if we can start training your hands and fingers directly with, let's say, plate grabs, where you're just holding a plate for a period of time. You could do pinch grip carries with multiple plates between your hands in order to really stress the site. This is the first place I would start before I start moving upstream into the elbow. So moving on from isometrics and focusing on the lowest hanging fruit, such as the hands, I would then work my way upstream into the elbow. Now, mind you, while I'm working on this, I'd want to make sure that the athlete or client is minimizing their training load and not pissing off the site of injury doing their sport. So it goes hand in hand here. Now, the next exercise I would prescribe, or I'd start looking at, you don't have to use a sledgehammer. It's probably going to be too aggressive. You can use a broomstick to do this. Now, we know that the function of the elbow, or one part of the function of the elbow, is supination. So as I'm turning my thumb away from my body, that is supination. As I'm bringing the thumb in towards my body, and that elbow is kind of coming in towards me, this is like internal rotation that's coupled with pronation. Now, if someone was dealing with, let's say, lateral elbow pain, I would still hit it all. I'd leave no stone unturned, because chances are they're definitely going to have a weak first point of contact as well. So first things first, with anyone, we would want to guide our way down into range, eccentrically load nice and slow, and then I would isometrically hold this position here with a yielding iso pretty much for 30 to 60 seconds, or as long as I could hold it, to start promoting that remodeling process or that healing process to push some of that fluid out of the tendon. I would then repeat that process, doing it with the pronators as well. And after I've gone through working on the pronators, I would then do it with flexion as well. So I would just come up, I would curl up, and I would just hold this position here. And I'd also do it with the extensors. And a simple way of doing that is you don't have to use a sledgehammer to do it. You could just get a band, come down, and hold for an isometric contraction as well. That way you're targeting isometric contractions through the function of the elbow at the site.